Hi, everybody. Lena here with Cooper. So today we are going to talk about what you should know about fleas and ticks. So fleas and ticks, to me, over my years of experience, are the two most common intruders as a pet owner that you will encounter. And if you don't, you are very lucky, very lucky. I call them intruders because they are very strategic and they find their way inside your house. And we didn't invite them, right? We didn't invite these little tiny creatures to come in and wreak havoc on our home and do harmful things to our pets. So the two intruders are fleas and ticks. They are very small, and I mean sometimes it's like pinpoint tiny. And they're like hitchhikers. They latch on to your clothing, they get onto the hairs of your pet, and then we just go inside. We don't see them. We didn't say, hey, come on, let's go in my house. And they come in. We don't know. And it's prime real estate for them. Okay, because now they have nice, warm, dark areas to hide, like underneath your furniture, in the carpets, under the rugs, under the beds, even in your hardwood floors, the little tiny crevices, because they are that tiny. And they nestle in and say, all right, we're going to post up and we're going to have a party and make more of us. And when I say more of us, there's like thousands and thousands of us. And that's how you get an infestation. So because we've had unusually warm seasons, because we really didn't have a winter, in my opinion, they never really left. They were just, hovering around, like waiting for, the perfect opportunity, because it hasn't really been that cold. We never had a deep freeze, right? So they're definitely around, and I've heard that they are projecting that this year will be a very high increase of ticks and most likely fleas as well. Now, you don't have to be going to the park or going hiking to encounter them. They are in your backyard, okay? They're in your backyard. Don't think it's not possible. They're in your backyard. They're out on the, in the lawn, in the grass, in the bushes. They're there. You just can't see them. So with the quarantine and social distancing, a lot of people have been at home, which is good, but you've also been out in your yards. And so this is why it's very important. And I wanted to connect with everyone to just little tips that you can do to help lower the risk of your pet encountering a tick or a flea. Now, the reason why they are harmful to your pets, because for one, ticks can spread disease, for example, Lyme disease. Now, if your pet comes down with Lyme disease, some of the symptoms that you might see is lameness, joint swelling, fever. And if you've already found a tick on your pet, then it's highly important that you address it with your veterinarian, so the next steps can happen, which we usually, do blood work. There's medication involved. So it's just important to know, did my pet have a tick? And if you didn't know, obviously you're not going to know, but there's things that you can look for. Now, fleas also cause havoc on the pets as well. The most common thing is called flea allergy dermatitis. So if your pet is itchy, scratchy, intensely scratching and itching, causing irritation, your pet has a skin infection, there's a possibility that your pet is allergic to a flea bite. And sometimes you can just take one flea. They don't need like a bunch of fleas. If they're having an allergy to a flea bite, one flea can make your pet go crazy, scratching. Fun fact on tapeworms internally in their body. The most severe case would be anemia, because when a flea is biting your pet, they're actually, taking a blood meal. That's how they feed. So now imagine you have a body full of tiny little fleas, taking blood meals. You're depleting your red blood cells. So that's what anemia is, a decrease in the red blood cells. And that can make your pet very, very sick. And that is an emergency. Okay. The first thing you can do is always, get your pet, and if they're outside, come in, just do like a full body exam. Just feel them all over. They're going to love it because it's like a massage. I would show you on Cooper, but he decided to leave. But, you rub them all over, but there's specific places that they like to hide. So just think of like tiny areas, unseen areas, like under the arms, the ears, the crevices in the ears, in the flank groin area. What else? And just look around. So prevention comes in many forms. There's sprays, there's baths, there's collars, there's oral treats. There's a lot of products out there, and I know it can get confusing. Again, this is why it's very important to talk to your veterinarian to figure out what product is best for you and your pet. Believe in year-round prevention, because if it's given year-round, I don't have to say like, oh, I don't remember. Should I do it now? Should I not? Or is it going to freeze? Nobody has time to wonder about the weather these days, especially, right? Want to focus on or at least do research and find out about, because if you're like, I'm not going to remember to do this every month, instead of not doing something, it's better to do something. So that's it. So for me, I use a chew for Cooper. Cooper likes to chew. He's sleeping, but let me see if I open this, if he will come on over. Come on over, Cooper. You want your prevention? Come on, Cooper. He's really lazy. It's called the Scoop with Coop, but sometimes Coop just wants to sleep. So people who prefer to have a monthly prevention, mark it on the calendar, put it somewhere so that you remember, like, yes, I gave it this month. This is when I have to give it next month. So that way you're not forgetting. So it's definitely easy. It's happened. I've done it before, not that often, but I have said, did I give it? Because I'm very diligent about like making sure I do it. But there are times where I'm like, did I do it? Because if you want to follow like the first of the month, the schedules are busy. You don't even remember. I don't even know what today's date is. so hence that's why he's just not getting it. So yeah. So that's the Scoop with Coop, and we'll see you next.